Hi, this is Vivian Rain with Dr. Bizboom, and on this video I want to discuss what happens or what should happen after you've done all of your marketing efforts, everything's gone successfully, and your new patients are arriving in your office. Some of the things that I cover seem, to be honest, basic, but they fall out, even in my practices. And so it's important that we review some basics and set some expectations for what should happen now that your patients are walking in. So first off, it's really important to make a great first impression. The saying is true. You never get a second chance to make a first impression. So make it good. So with a new set of eyes, I want to challenge you today to walk out into your office. Take a look. Look around with fresh eyes. Is it clean? Is there clutter? How does your staff look? How do you look? Are people in uniform? Does your staff have a name tag on? Does the office need a little paint touch up? So first off, just do like an inventory. Are you presenting the face that you should be presenting to your patients as far as what your office looks like, what your staff and yourself are presenting, right? And have a team meeting on it. Clean scrubs, if they're supposed to wear scrubs or whatever their uniform is, if they're supposed to wear a white jacket, if they're supposed to wear a name tag, all of these things should be in, right? Okay, the other thing, we run busy practices. A lot of you guys will run busy practices or get very busy at times. It's important that I tell my staff I want them to be ducks. And what I mean by that is, if you've ever seen a duck, they're peacefully gliding along the water, looking just beautiful and calm. But under the water, their little legs are working super fast, right? That's what I want. I want to have a calm and happy appearance for the patients. When you talk to the patient, not to be in a rush, take time, fully acknowledge them, greet them with a warm smile. But when it's time to go, I want them to be moving fast and efficiently, right? I want all of the things they're doing behind the scenes and making happen. I don't want that to be what it looks like to the patient that they're talking to, right? It's really important that whatever you're doing, when a patient's there, you stop and you give them your undivided attention and you handle them fully and you very much acknowledge them and make them feel heard and welcomed. It is key and it needs to happen every single time. If your front desk is on the phone and somebody is walking in, the person in front of them needs to take priority. So they need to say, hold on one quick second. Hi, it is so great to see you. Please sign in. I'll be off the phone in just a second and we'll give you my undivided attention, help you with anything you need. And then finish the phone call promptly. It is really key. It is one of my biggest pet peeves when I walk in an office and the front desk person doesn't look up and immediately greet the person and instruct them on what to do. They have come into your house now. It is your show. They need to be guided and told where do they need to go. Should they sign in? Should they fill something out? Should they sit down? Is it your office policy to offer them water or tea or a magazine? Whatever it is in your office you do, you should stop today or tomorrow morning and have your staff drill welcoming a person into the office, whether it's a new person or whether it's a patient that comes in all the time, and get that first impression down. The other thing is to properly route patients quickly. So in our practices, and you need to establish what this is for yours, no patient should ever wait longer than 10 minutes. And I know that that's a high bar, but I know how awesome all of you guys are, and that should be what is acceptable and doable. A patient shouldn't have to wait longer than that. And if they are, you have a problem. You have a problem getting your cycles done timely or in your schedule, and either or both need to be corrected. You should value a person's time. They got there on time. You should see them on time. And it's really important, especially if you're going to be pitching a care plan to treat them that has them coming back multiple times. If they waited 30, 45 minutes in your lobby, that's the impression you gave of how timely or untimely your office runs. And that means that they're going to be waiting that long every time they come, and you're asking them to come 10, 12, however many times you're asking them to come back on a care plan. So if ever anybody waits longer than 10 minutes, my staff actually apologizes and says, we greatly respect your time. Our standard is 10 minutes or less on your wait time. We apologize that we didn't meet that standard today, and we will next time. But to compensate you, here's a Starbucks gift card for your time. and really lets a patient know what our standard is and the level of service that they will receive. I want everybody who comes in to your practice to know that this is a 5-star experience and unlike anywhere else they've ever been for their healthcare. This is not sitting in some doctor's office where you're ignored and you wait for an hour. This is something different, and they need to know that the second they step in your office. Then they need to be routed properly, whether it's a treating patient that needs to be roomed, whether it's a new patient that needs to be given paperwork, or shown to an ROF room, whatever it is, they need to be routed effectively and efficiently. And the whole team should know what's going on, who's that patient, where are they going, right? What time did they arrive? On our documents, if you use them, there's actually a time to chart when the patient arrives so that you guys know how efficiently you're working and if you need to be moving faster for this patient. If a patient's having a problem with some intake paperwork or it's running behind, stop and help them. Stop and help them. Sit down and actually be the person who helps them fill it out. Have them sign all the lines and things, but assist them and really give some 5-star service and make this like anywhere else they've ever been. I know you guys have amazing practices. I know just by the fact that you're watching this video that you're looking to do an even better job and continue on improving. See what you guys can really do to improve your patient experience. It goes miles in both your pride in delivery and your patient happiness, and happy patients get healthy, right? So that's my challenge to you guys after watching this video is sometime today or tomorrow at the latest to take stock of your office and observe your patient greetings and how they're being routed, and then drill with your staff to improve it. I know you guys can nail this. I have such faith in you. Have a great day.